Okay, yeah, so thank you, Brian. Yeah, as Brian said, I'm in the final year of my PhD at Nottingham, so I've got a busy few months ahead of me. So I thought it would be good to give people an overview of the whole of my PhD, just to kind of give a start to end kind of story. So in short, the aims of my PhD were to develop a digital version of an existing card sort task for self-harm, which we call CATS. So I'll refer to it as that from here on in, and to use it to examine the self-harm pathways in LGBTQ plus and general populations. And this will enable us to identify key risk and protective factors which can be used in support interventions. And it'll also support the development of policies which aim to reduce self-harm. So I'll give you a brief overview and background of self-harm, and then I'll introduce you to CATS, and then I'll talk to you about the studies I've undertaken during my PhD. So self-harm is a significant public health concern here in the UK and worldwide, and it's particularly prevalent in adolescents and young people. Research indicates around half of people will self-harm at least once. Self-harm can have serious impact on people's health and well-being, reducing both physical and mental health, leading to financial hardship, and substance and alcohol use, amongst other things. It's highly prevalent in the general population, with between 16 and 22% of people experiencing self-harm. But in some groups are at greater risk, and it's especially prevalent in LGBTQ plus people, with research suggesting around 30% of sexual minorities and almost 50% of gender minorities will self-harm. Most concerningly, though, it's the most significant predictor of later death by suicide, with around half of people who die by suicide having a history of self-harm. So considering this, efforts to reduce self-harm are key suicide prevention strategies. And it's also really important that we develop meaningful research tools which can effectively identify risk and intervenable factors remains important. So this is cats. So we know that there are many varied risk factors for self-harm, and historically these have been researched in isolation. But this is problematic because people experience a multitude of factors on their pathway to self-harm. So the card sort task for self-harm, CATS, was developed to be for use in research to simultaneously examine multiple factors and when they occur along a timeline. So this is a quick example that I've done. So it will be performed during an in-person research study. So along the top there, you've got timelines or time cards which go from 6 months prior to the point of self-harm and then afterwards. And then there are 117 cards which people then place under the pathway at the time point which is relevant to their particular journey. However, there are some limitations to CATS. So it was developed in 2013, and since then our understanding of self-harm has changed, and there have been significant global events which may impact and lead to self-harm. Factors have emerged since then which need including in CATS to ensure it remains a useful and meaningful research tool. So part of my PhD focuses on identifying updates and amendments to CATS to ensure it does indeed remain a meaningful research tool. Now, the first study I undertook in my PhD was a systematic review of literature. So within the LGBTQ plus umbrella, trans people are at particularly increased risk. Evidence is beginning to emerge of factors associated specifically with trans self-harm. However, the evidence wasn't synthesized in a review. So this systematic review aimed to examine existing literature regarding risk and protective factors associated with self-harm in this high-risk group. And it'll also highlight whether factors specific to trans self-harm may be usable intervenable targets, and also whether particular factors may be important additions to CATS to ensure it's inclusive and appropriate for use in high-risk groups. The review included 78 studies with over 322,000 participants aged from 11 to 94 years. And studies were performed across the globe, including Hong Kong, Lebanon, the USA, and across Europe. Three key protective factors were identified. These are social and family support, connectedness to parents and non-parental adults, and school safety. The findings indicate utilising and developing support networks and engendering safe school environments will likely reduce self-harm in trans people. And the review also identified six risk factors, and these are younger age, being assigned female at birth, illicit drug and or alcohol use, sexual and physical assault, depression and gender minority stresses, particularly discrimination and victimization. This review was published last year, so it's available if you'd like to read it. And recommendations based on this review are to encourage and support trans people to utilise their support networks, creating the safe school environments, and also improve efforts to reduce drug and alcohol use, and also to develop policies and interventions which reduce gender dysphoria, depressive symptoms, discrimination and victimisation aimed at this high-risk group. Now, initially in my PhD, I aimed to recruit general and trans populations. However, I struggled to recruit trans people. So the focus of my PhD widened out to include the wider LGBTQ plus umbrella. And so to address some of the limitations of CATS, it largely that it was developed and needs updating. It was important to ensure it was relevant and appropriate to self-harm. So I invited people with lived self-harm experience to take part in an interview study which captured their views on the existing cards and identify possible changes necessary to improve the relevance and appropriateness of it. And it's really important to include people with lived experience for if our research is going to be meaningful. I recruited 13 participants for one-on-one interviews and performed thematic analysis on this data. And I asked whether cards or themes needed adding to CATS and whether amendments to existing cards were needed. So in addition, well, in total, 12 cards were added. I won't go through them all, and I know that writing's quite small, but I'll just talk through a few of them. So firstly, participants felt that an additional time point was necessary to capture historic events. So the existing task had a from 6 months prior to the to self-harm, but people really felt it was important to capture historic, particularly events that occurred in childhood. So we've added a before 6 months card, which will document those historic events. Other cards added were things like I did not feel comfortable in my body and I felt I didn't fit in, which people felt could be relevant to LGBTQ plus people, but also people in other populations, so different religious or cultural backgrounds. And probably unsurprisingly, all participants felt that social media should be mentioned within the cards. So one thing that came from the data is that things that happen in the real world also happen online. So there is a card that says I was bullied already in the cards, but people felt adding I was bullied online or on social media were important to add because people are often bullied in both settings, and it's really important that the cards document this. Um, Data also showed that people can find a support, not just for self-harm, but a sense of community online. So I've added a card which allows people to document that they found a support network online. And LGBTQ plus people felt that being bullied and discriminated against because of their gender or sexual identity was a key factor for their self-harm and should be included in the task. So these cards have been added to ensure it captures that data if it occurs. And those findings particularly tie in with findings from the systematic review, which identified discrimination and victimisation as key risk factors for trans people. So we're hoping that these additions will mean that CATS is a really inclusive tool which captures people's pathways regardless of their background or identity. So if we return to CATS, there are some other limitations to it being used in person. So it's quite time consuming for participants and researchers, it limits participant opportunities and it's costly. And finally, the cards can only be used once and participants were asked to place the card under the most relevant time point for their pathway, but it could occur across across all time points. So CATS really needs to reflect this. So to address this, I've developed a web app version of CATS, which is called CATS Electronic or CATS E, which needed to be pilot tested. So I worked with a developer to develop this, and it looks like it does on the left-hand side. So it's aimed and designed to work on a mobile phone. So people are presented with a card and then they're able to select multiple relevant time points as possible, or they can, if it's not applicable, then they'd click not applicable. And they'll work through cards individually like that until they've completed the task. And we recruited 14 people to pilot test CATS to make sure it works, which it does, which is great. And we also asked questions about the usability of CATS. And the data here found that participants felt that the that cats was a usable, it was a feasible research tool. And we also captured mood data to ensure taking part in research utilizing CATSI didn't have a negative impact on participant mood. And the pre and post study mood data was collected, and the findings were that it didn't negatively impact participant mood. So together, these data suggest that CATSI is a feasible research tool, and the online nature of CATSI ensures it's capable of capturing really large data sets, which will provide a stronger evidence base on which to base clinical intervention and policy recommendations. Now, in my thesis, these are two separate chapters. However, because the two studies relate to updates to cats, myself and my supervisors have merged the two studies, and we submitted this to journal earlier this year, and it's currently under review, but is available as a preprint if anyone would like to read that in more detail. Now, the final study of my PhD was a large-scale study using the newly developed CATSI to examine the self-harm pathways in general and LGBTQ plus populations. And the aims here were to identify key factors or groups of factors and when they occurred in those populations, and also to identify whether groups of factors may predict self-harm in the populations, and also whether group-specific factors may predict self-harm in each group. And I've recruited 100 participants online who completed CATSI. I've finished data collection now, and I'm currently analysing these data. So my next steps, I've only got a couple of months left of my PhD. So I've got that final bit of data analysis to complete and finish writing my thesis, which I've been writing all along before I'll be submitting it in a few months' time. But thank you for listening. Thank you to Mental Health Research UK for funding my PhD and for my participants for their invaluable input, to my supervisors for their constant support, and also to Ian Greentree, who has helped me develop CATS-E. And thank you all for listening today.